public health care facilities in the Northwest have been plagued by chronic medicine stockouts for years now. The Northwest Health Department has been conducting an annual pharmacy outreach program. It's aimed at helping pharmacists and managers avoid running out of stock of essential medicines. According to a community-led clinic monitoring project, Ritshidze, the province is one of the worst performing in medicine availability. Refiloe Seboko joins us now. Very good morning to you, Refiloe. One of the worst performing when it comes to medicine availability speaks to a lot of people who are going around the province without proper medical treatment.
Of course, Paul, this is why we see some of the patients still return home without getting the relevant medicine that they need. As you rightfully say, that stock out that is happening in the Northwest Province now. It's something that has been going on for years, where patients that goes to different facilities, health facilities that is in the Northwest Province, they still find having to return home without that medication that they need. And that some different reasons that were explained by the Department of Health in the Northwest Province to say that some of the reasons the facilities that has stock out is as a result of a budget shortfall. It's as a result of challenges of ordering and delivering from service providers, that the companies that needs to be sending this medication so that patients can be able to get proper medication even on time. Those are some of the things that was explained by spokesperson of the Health Department in the Northwest, Seboko, to say they are faced by the challenge of companies that needs to submit or rather deliver on time this medication. But that, it continues to affect residents of Northwest Province that still find themselves in a position where they don't have medication for their chronic illness.
And perhaps talking to some of those who haven't had access, I mean, what impact has that had on their lives?
You'll understand, when one does not take their medication, it becomes a relapse. You are, not being able to be properly functioning, or rather, it's a setback for your health, even. And they are saying that we can't be able to be taking our medications on a daily basis when one is going to a facility and they return home without getting their medication. The patients like those of diabetes, together with high blood pressure, they say that some facilities in the Northwest Province that they go to, they still find that there's that challenge of not finding relevant medication. But the Department of Health in the Northwest Province, again, spokesperson Seboko, indicating that facility managers together with district pharmacists have been orientated previously on how they need to manage stock of medicine so that they don't run out, or there's a stock out of medicine in the province. They are saying that they have been orientated previously. They continue to orientate these district managers together with facility managers to control the medication for patients. But that still seems to be a challenge, as in other districts in the Northwest there is a stock out of medication, whereas in other districts, the other part of the Northwest, there is medication, and therefore residents are not that bad affected.
Okay, very well. Let's leave it there for now. I would imagine that this was exacerbated by the COVID-19 pandemic, but it's a story that we will continue to reflect and touch on throughout the course of the day.